Assalamu alaikum warahmatullahi wabarakatuh. Welcome to our second lecture in our radiology course. I am Dr. Nihad al-Ma'moon. Previously, we have the definition of radiology. What is radiology? The definition stated that radiology is a medical specialty using medical imaging technologies to diagnose and treat patients. Then we had a brief talk regarding the different radiological modalities, starting with X-ray, fluoroscopy, CT, nuclear medicine. Now, in our second lecture, we will cover magnetic resonance imaging, ultrasound, and interventional radiology. In definition, MRI or magnetic resonance imaging. From its name, magnetic means magnet or مغناطيس. Resonance mean اهتزازات imaging. So that magnetic resonance imaging, we put the patient inside the MRI magnet. Every hydrogen atom within the water molecules within the human body align or has the direction like north and south of the magnet itself. Then it has a type of motion called resonance أو الاهتزاز. According to the frequency of the resonance, we take the image of the MRI. This is the verbal or brief explanation of MRI or magnetic resonance imaging. Regarding the definition of MRI, MR imaging is a non-invasive technique that doesn't use ionizing radiation. So in MRI, we doesn't use ionizing radiation like in X-rays and CT and gamma rays in nuclear medicine. It uses a pulsed radio frequency beam in the presence of high magnetic field to produce a high quality image of the body in any plane. So in MRI, we have two things. A high magnetic field is used and radio frequency pulses. The nuclei of any atoms with odd numbers of nucleons, protons, and neutrons behave like weak magnets in that they align themselves with a strong magnetic field. So, the scientist discovered that the hydrogen atom has one proton in its nuclear components. This proton acts as a magnet and has a weak magnetic properties. So when we put the hydrogen atom in a strong magnetic field, it can align in its direction. And since Allah subhanahu wa ta'ala said وَجَعَلْنَا مِنَ الْمَاءِ كُلَّ شَيْءٍ حَيٍّ, then we have 70% of our bodies from water, formed from water. So we have a plenty of hydrogen atoms that we can use it to make our magnetic resonance image. Back to the text. If a specific radiofrequency signal is used to perturb the nuclei under study. So what does it mean? If a specific radio frequency signal used to confuse or change the status of the nuclei under the study, then we can apply different times to take our MRI image. Again, the definition of MRI. MR imaging is a non-invasive technique that doesn't use ionizing radiation, uses a pulsed radio frequency beam in the presence of high magnetic field to produce high quality image. This is the definition. MRI uses magnetic properties of a spinning hydrogen atom to produce image. We have advantages and disadvantages of MRI. Advantages: if we take an MRI image in a certain plane, we can reduce the other plane. Not like X-ray. X-ray, if you take an anterior-posterior view of just X-ray, you can't make a lateral view. But here in MRI, you can do it. So the first advantage of MRI images can be produced in any other plane, including the sagittal and coronal multiplanar capabilities. Sagittal and coronal type of cross-section means that you cutting the patient in sagittal from right to left, in coronal from anterior to posterior, because you are treating a 3D image, which is multiplanar image. Multiplane means متقطع في عدة محاور. That is the multiplanar or type of reconstruction أو تقطيع للإيمج. The second advantage compared with CT are the absence of ionizing radiation or any other apparent biological hazards. So the MRI has no ionizing radiation, فبنعتبرها safe. The third advantage is excellent soft tissue contrast and characterization. Any types of soft tissue abnormalities that can't be visualized in X-ray or in CT, we proceed to MRI. Lack of artifact from adjacent bones. So in X-ray and in CT, some soft tissues can be affected with the density of the adjacent structure. But in MRI, there is lack of this type of artifact أو عوامل التشويش. Moving to the disadvantages of MRI. MRI is a time-consuming procedure, time taken to complete examination. In comparison with X-ray, the exposure time to take an X-ray image is only 2 seconds. The time to complete a CT scan, it takes like 5 minutes as maximum, but in MRI, the minimal procedure take from half an hour, 30 minutes and above. So the first disadvantage is that MRI takes sometimes. It higher cost. MRI is more expensive than CT and X-ray and other type of radiological modalities. Young children and infants usually require general anesthesia because they can't stay calm when taking the MRI image, or they can't stop for this long time. Then safety issues, contraindication like surgical clips, electrical devices such as pacemaker. Because we use a strong magnet, when a patient has a metallic object like the surgical clips in his body, the magnet can expel it from its place, which is so dangerous. So we have some contraindications and safety issues regarding the MRI in other type. A small loud tube and patient must be able to hold still. It have a loud noise from the coils and radio frequency, so it can cause some noise. So you have to clarify to your patient that when you will do your exam, you will hear some noise, don't be afraid. Regarding the application and uses of MRI, We use it in musculoskeletal imaging for joints like knee, shoulder joint, and imaging joints and muscular abnormalities. And the other indication including the abnormalities within the pelvis. If a pregnant lady have some abdominal abnormalities or conditions, we can use MRI instead of CT or X-ray because it is safe. Here we have an MRI machine which looks like the CT gantry. Let us see an MRI explanation video for further understanding. Let's start.
After carrying out your safety checks, bring the patient into the scanner room. Help them to lie supine on the bed with their head in the head coil.
طيب بنلاحظ إنها في الفيديو قالت after you check your safety precautions. Safety first, you have to make sure that the patient who will be imaged is your patient and check his name and type of procedure or protocol. Then to check if the exam need any type of fasting, food stoppage, or having oral contrast or IV contrast. The patient is comfortable in his clothes because the exam may take some time. Then you have to tell the patient to move the metallic objects and make sure he take it with him when he finish and in his time for his appointment. This is the safety precautions what should be applied before starting the exam. Also, if your patient has got some type of asthma or allergy, that's it. Now back to our video.
Carrying out your safety checks, bring the patient into the scanner room. Help them to lie supine on the bed with their head in the head coil. Provide the patient with an emergency buzzer and make sure they know how to use it. The patient with an emergency buzzer and make sure they know how to use it. Provide headphones to protect the patient's ears.
She gave the patient a brace in cases of emergency or he need help. Okay, and also headphones to protect their ears.
And put the head coil in place.
In MRI we have these coils which improve the resolution of the image. We call it service coils because it is put outside the machine and there is inherent coils within the machine itself. It looks like a cage and improve the MRI signal.
Center to the glabella and move the patient carefully into the scanner. Make sure they're calm and comfortable before you leave the room. Once you're back in the control room, select the correct patient details in the browser, or you can type them in manually if necessary. It's very important to get the details right, including the correct patient weight, so that the SAR can be calculated accurately. Register the patient as lying head first and supine. Select the correct protocol according to your hospital and radiologist guidelines. Begin with an initial scout or localizer sequence in 3 planes. Plan your axial sequence in all three planes. On the sagittal localizer, axial slices should pass parallel to a line joining the inferior border of the genu and the splenium of the corpus callosum. The slices should cover the brain from vertex to below the foramen magnum. On the coronal localizer, the central slice should pass along a line from the superior sagittal sinus through the third ventricle and down the center of the brainstem. Center the axial localizer in the field of view and apply. Now plan the next axial sequence. You can copy the planning and centering from your first T2 axial. Make sure the coverage and centering are correct and apply. Repeat this process for the T1 and any subsequent axial sequences. Now continue with the post-contrast sequences. You should review your images as the scan proceeds. In T2 images, fluids and fat will appear bright. Most pathologies will also appear bright on T2. FLAIR is a fluid attenuated inversion recovery sequence. Fat will appear bright, but fluid will appear dark, and most pathologies will appear bright. FLAIR sequences are useful for showing pathologies close to the ventricles and sulci, where the CSF shows bright on normal T2 sequences. On the T1 sequence, fluids appear dark, fat is bright, and most pathologies will appear dark. This is a coronal T1 sequence. This sagittal is a T2 sequence. This B0 diffusion scan sequence looks quite similar to a T2 because the diffusion value is 0. This is a T1 post-contrast axial sequence. In this case, you can see multiple enhancing lesions. In comparison to the T1 non-contrast axial scan. T1 coronal sequence, the lesions are again visualized as bright areas.
This is after or post-contrast studies showing a brain mets or brain lesion, multiple.
Remind the patient to lie still, as they may need to be moved out of the scanner to administer the contrast.
Now let's move to our another video or second video regarding how MRI machine works.
X-ray and CT, MRI uses a magnetic force, which is found all around us and does not damage the tissue as it passes through. My name is Pauline. I'm a Belgian nuclear medicine resident, and in this short video, I will explain the basics of an MRI scan. The MRI scanner is essentially a giant magnet. The strength of the magnet is measured in a unit called Tesla. Most MRI scanners used in hospitals are 1.5 or 3 Tesla. Putting that into perspective, a 3 Tesla MRI scanner is around 60,000 times stronger than the Earth's magnetic field. The stronger the magnetic field, the more detailed the images become, which means the body can be imaged either at a greater resolution or at the same resolution but faster. MRI uses magnetic fields and radio waves to measure how much water there is in different tissues of the body and then uses this information to generate a detailed image. The images are so detailed because our bodies are pretty much entirely made of water. Our lymph nodes, our blood vessels, and even our bones are soaked with water molecules. A water molecule is made up of 2 hydrogen atoms and 1 oxygen atom. The hydrogen atoms are the part that makes water interesting for MRI. If we look at hydrogen in more detail, we see that it has a central nucleus containing a single positive charge, called a proton. Each spinning hydrogen proton is like a tiny magnet that spins around on its own axis. This spinning motion is known as precession. Under normal conditions, all the billions of hydrogen protons are in random positions spinning on their axis. Think of it as a group of children on a playground running around with no sense of order. However, this randomness changes when we place a human body into a very strong magnetic field. Just like the north and south poles of a compass tend to align with the magnetic poles of the Earth, in the presence of a strong magnetic field, each proton in water twists its orientation so that it aligns with the field. Now think of those same children with no order and how each one will line up when the teacher calls. But while the magnetic field makes all the protons want to line up, the MRI machine intentionally disrupts this field by sending a brief pulse of an additional, weaker electromagnetic field, called a radiofrequency pulse. This weaker pulse points in a different direction than the magnetic field, and so it disrupts the protons so that they become misaligned with the constant field. As soon as the radiofrequency pulse is switched off, the protons still back to their original position, and as they do, they give off energy. To measure this emitted energy, we require some special equipment called a coil that is placed around the body part we are imaging. Protons in the different kinds of tissues all give off different amounts of energy. This is why computers are able to tell the difference between various types of tissues. Thank you so much for watching this video.
This video clarifies that we have two types of MRI machines. The closed type, which like this, which visualizes.
The strength of the magnet is measured.
This is the closed type. And we have the other type, the open MRI machine. Here it is, the open type of MRI. We use the open type for patient who has claustrophobia أو phobia المناطق الضيقة, claustrophobia. Those patients, the open MRI machine is preferable for them than the closed one. Here the open and here the closed type. And regarding the strength of magnetic field, we have two types also of MRI.
Most MRI scanners used in hospitals are 1.5 or 3 Tesla.
And the used that are used nowadays are 1.5 Tesla and 3 Tesla. 3 Tesla is better resolution than 1.5 Tesla. Now let us review some images to know the difference between T1 weighted images and T2 weighted images. The maximum difference regarding the CSF color within the ventricles. We can notice here the CSF is dark in the anterior horns of brain lateral ventricles in a T1 image. When we move to T2 weighted image, the CSF density is in white color into T2 image, even within the sulci of the brain. Again, here we have T1 weighted image. CSF is dark. T2 weighted image, the fluid is bright. Another difference in MRI brain, the gray matter and white matter. When we say that T1 weighted image is an anatomy image. Why? Because the white matter is bright in T1 and the gray matter is dark in T1. So it is the sequence of anatomy. White is white, dark is dark. So in T1 weighted image, white matter, which is within the corona radiata of the cerebral cortex, is white or brighter than the dark gray matter in the cortex over here. But in the center is the interdigitating white matter. Moving to T2, now focus on white matter only, which is in the center. Here, white matter is dark, but the cortical gray matter is more brighter than it. So we can differentiate through CSF density, fluid density, gray matter, and white matter between the two types of image. Move to another example. What do you think regarding this image? Yeah, you are right. This is T1 weighted image because the CSF within the spinal canal is dark over here, but it is bright here in T2 weighted image. What about this? Yes, you are right. CSF is dark, then this is T1 weighted image, and this is T2 weighted image because fluid is bright. CSF dark, then T1. CSF is bright, this is T2 weighted image. Dark, T1, bright, T2. Here also, this is T2 and this is T1. CSF surrounding the spinal cord. This is abdominal CT. We can notice the fluid within the gallbladder and the ureters. Here it turned to bright in the gallbladder and ureter because it contains fluid. Here in the pelvis, T1 weighted image because the urine within the urinary bladder is dark. This is T1 weighted image, but this is T2 weighted image because it's bright. Knee joint, the synovial fluid inside the joint is dark, here is slightly bright. Hand MRI, synovial fluid also is bright in T2. This is polycystic kidney disease. There is multiple cysts within kidneys bilaterally. Here they are bright in T2, but they were dark in T1. That's it regarding our examples for the difference between T1 and T2 MRI weighted image. Now we move to the indications of MRI brain. Transient ischemic attack in cerebrovascular accidents, TIA, in cases of infection, inflammation, meningitis, encephalitis, HIV patient or AIDS patient, or tuberculosis, cognitive decline, neurodegenerative disorders, dementia, demyelinating disease like multiple sclerosis, loss of consciousness, seizures, epilepsy, especially if first time or for follow-up, brain tumors, suspected mets or abscess. But in such case, we can give IV contrast to delineate the intracerebral lesion, cerebellar lesions, brainstem lesions, congenital abnormalities, post-operative follow-up, vascular pathologies, headaches, hemorrhage. These are the indication of MRI brain. Regarding the contraindications for MRI brain, any electrically or magnetically or mechanically activated implant like a cardiac pacemaker, insulin pump, biosimulator, neurosimulator, stimulator, cochlear implant, and hearing aids. Intracranial aneurysm clips unless made of titanium, because titanium isn't affected with magnetic field. Pregnancy. In early pregnancy, MRI is contraindicated, but we have to weigh the risk and benefit. Ferromagnetic surgical clips or staples, metallic foreign body in the eye, metal, shrapnel or bullets. Now it is time to move to some pathological cases regarding MRI, starting with brain. Here we have got a patient who has brain mets from other cancer. This is T1 image showing there is a slight change in the area of the cerebellum. This is axial T1 after giving the patient contrast, showing the mets have some type of enhancement. Here T2 showing that the central area which appear here dark in T1 is white. That means this is area of necrosis within the area of mets. Another type of image confirm the findings of brain mets. Our next case is pituitary adenomas. Pituitary gland situated in the sella turcica or pituitary fossa. Here is the abnormality, which is equal to the intensity of the brain in T1 pre-contrast and enhancing after contrast. Here a sagittal image, here a coronal image, another coronal image. The most important application of MRI in cases of infarction. So MRI can detect infarction within minutes when there is a cut in blood supply to the brain tissue. Here we have middle cerebral artery infarction appear at this change of hyperintense area in T2 weighted image. And low in T1 weighted image, showing diffusion restriction between ADC map and diffusion weighted image. Such here, bright and diffusion weighted, and some area with black. This means it is restricted. Means the particles within the lesion is restricted from normal movement. We can notice the difference between the infarction and the metastasis, that in infarction we doesn't have any contrast enhancement. Like in metastatic lesions, there is no enhancement post contrast. This is how we differentiate between infarction and mets. Also, we have type of magnetic resonance imaging called MRA, which is MR angiography, where we assess the blood vessels. We inject contrast and then visualize the blood vessels. Here we have a case of perianeurysm. which appear as aneurysmal dilatation within the wall of the internal cerebral artery. Internal carotid artery. Here an axial image of the same perianeurysm. Another image of perianeurysm. It calls time of flight maximum intensity projection because it appear or visualize the maximum intensity signal within the blood vessels. Here we have a case of arachnoid cyst which appear high, very high in T2 because it containing fluid CSF, and appear dark in T1 weighted image. That's why different weighted images in MRI can differentiate and confirm the type of pathology. After we finish MRI, then we move to our next modality, which is ultrasound. Ultrasound, high frequency sound waves are transmitted from a transducer and pass through tissues. Reflection of the sound wave are picked up by the transducer and transformed into images. Reflection or echo occur when the sound wave passes through tissue interfaces of different acoustic densities. Ultrasound type of radiological modalities that use high frequency sound. It uses a transducer or probe. Here an image of the transducer or probe which emit the ultrasound waves and receive it back. Structures are described based on their echogenicity. Hyperechoic structure appear as bright, ultrasound reflected, whereas hypoechoic structure appear as dark. So when we was speaking regarding the X-ray and CT, we are speaking about densities: high density, low density, radio-opaque, radiolucent. When we speak about MRI, we are speaking regarding intensity: hyper-intense, low intense. When we speak regarding ultrasound, we speaking regarding echogenicity, because it's all about the reflection of the echo. Hyperechoic, which is bright, hypoechoic mean dark or black. Ultrasound waves not reflected back but pass through, where it's dark or black. Higher ultrasound frequencies result in greater resolution but greater attenuation. Deeper structure more difficult to visualize when the frequency is higher. Artifacts acoustic shadowing refer to the echo-free area located behind an interface that strongly reflect tissue air surface or absorb tissue bone surface. That's why ultrasound is good in imaging the cystic structure or the fluid-filled structure, but have a very bad resolution in bone and hard objects like stones, for example, which has acoustic shadowing posterior to it, because ultrasound can move or pass after the stones or the bone. Enhancement refer to the increase in reflection amplitude, increase the brightness from objects that lie below a weakly attenuating structure like the cyst, like the urinary bladder, gallbladder, where there is fluid. There is some type of ultrasound called Doppler ultrasound. Doppler ultrasound, type of ultrasound that applied to visualize the blood vessels. It determines the velocity of flowing blood past the transducer based on the Doppler effect. Duplex scan means Doppler with visual image. Advantages: relatively, the ultrasound has low cost in comparison with CT and MRI. It is non-invasive, but sometimes if we use it in interventional radiology, we call it invasive ultrasound procedure. It has no radiation, looks like MRI, no radiation hazards. It is real-time imaging because it is done in its time. May be used for guided biopsies, many different imaging planes, axial and sagittal, transverse, longitudinal, for example. Determines cystic in comparison with solid. The disadvantages of ultrasound are it's highly operator dependent, according to the doctor or technician who is applying the ultrasound. Air in bowel may prevent imaging of midline structures of the abdomen like pancreas, may be limited by patient habitus. If an obese patient have been imaged, we might face some difficulties. This is regarding the definition of ultrasound, the uses of ultrasound, and advantages and disadvantages. Let us now move to animation video to show us the background regarding the ultrasound and how it creates image.
For use in obstetrics is because unlike CT imaging and conventional radiography, which uses X-rays, ultrasound uses sound waves, so there's no ionizing radiation, thus there's no risk of damage through the sound waves to the patient's DNA. So how does ultrasound work? Well, there's some equipment that's needed. Firstly, you have a transducer, and there's several different types of transducers, and they're specific to the type of exam. Some transducers will emit sound waves that allow you to penetrate deeper tissue, while some will allow you to penetrate only more superficial tissue, and depending on what you want to see, whether it's a thyroid gland, which is superficial, or some of the abdominal organs, which are a little bit deeper, you can use that appropriate transducer. Now, inside this transducer, there is a special structure made up of piezoelectric crystals. And what these crystals do is that they change shape with an electrical impulse. So if we give an electrical impulse, it'll start to vibrate, get bigger, smaller, and this generates sound waves. Now these sound waves go from 2 to 20 megahertz in frequency. For comparison, audible sound is 20 to 20,000 hertz, so we don't hear these sound waves. And as those sound waves go through our body, they will travel differently in different structures. At any interface that these sound waves interact with, the sound waves may be transmitted, they may be completely reflected, or often something in between, where something gets reflected, something gets transmitted. Whatever signal goes back to the transducer, this deforms this piezoelectric crystal again, and that results in an electrical impulse that then gets recorded by a computer. So if we were to look at an ultrasound image, basic orientation, you can either have the probe so that you slice through the patient in an axial plane or through a sagittal plane, in which case this side of the patient will always be either the right side or cephalad side, depending on whether it's an axial or a sagittal cut, while this side of the patient will be the left side or the caudal aspect of the patient. The side over here is always the most superficial aspect, so this is going to be the skin, this is where the transducer will be placed, and as you go deeper, these will be the deeper tissues. On every ultrasound image, there is a little marker called a probe marker. It's marked by this small letter P over here, and this can also be found on the transducer itself, where there's a little bump that corresponds to where that probe marker should be. You can see it over here in this linear transducer that's useful to look at more superficial structures such as the thyroid gland, and we can see it here on this curved transducer that penetrates into deeper tissues and allows us to look at structures like the liver, the pancreas, the spleen, etc. And so if we go back to the concept of the sound waves interacting with the different tissues. As we mentioned, they can be completely transmitted through that tissue, they could be completely reflected, or often something in between. Now, if something's made up of pure fluid, it turns out the sound waves will go directly through that fluid-filled structure. As a result, there will be a positive signal that goes back to the transducer, and that'll appear black, anechoic, dark on imaging, as we'll see in the next few slides. If something is completely reflected back, as can be seen with the interaction of sound with bones and air interfaces, well, there's lots of signal, because everything is going to go back to the transducer, so it'll appear very bright or hyperechoic, and everything behind that area will not be seen because there's nothing that's going through, so everything behind that area that's reflected will be very dark. And if it goes in between most tissues like soft tissues, muscles, and fat, well, it can be either different shades of gray, and it can be very bright or hyperechoic, very dark or hypoechoic, or it can look like the surrounding soft tissue, in which case we call it isoechoic. So if you use those two concepts to evaluate this case, look at these two renal masses. Which one is cystic and which one is solid? And why do you think so? Well, as you may have guessed, this structure here is cystic while this one is solid. As the sound waves go through this structure, nothing gets reflected back from the structure itself, only from its interfaces or its peripheral borders. Therefore, there is no signal inside this structure, and therefore we know that it's something that is cystic. If we look at this case over here, as the sound waves go through, some of them may pass through, but a lot of them will get also reflected backwards, resulting in a very complex appearing solid mass in this kidney. So here are some ultrasound characteristics of a simple cyst, and this applies to a cyst in any organ within the body. It'll be anechoic or black. The walls that we'll see will be extremely smooth, well circumscribed. You can trace them with a pencil. The soft tissues immediately behind the cyst will actually be brighter than the adjacent soft tissues. And that's this idea of posterior acoustic enhancement. Because if you have sound waves going through this simple cystic structure with nothing going by, they'll go from the backside of it relatively unperturbed, as opposed to the adjacent soft tissues where some of the sound waves will go through and some of them will go back. So the signal coming from there will be less than the signal coming from immediately behind this simple cyst. The wall posteriorly will be extremely sharp as well. So again, that's a cystic mass and that's a solid mass. How about this case over here? This is a image taken from the patient's mid-abdomen. This structure here is actually the pancreas. That's the gallbladder. There's a portion of the liver we can see over here. What do you think this structure represents? If you look at it, as the sound waves go through, there's a very sharp interface over here. Behind it, it looks rather dark. It doesn't look completely black like the simple cyst, but it looks rather dark, almost as if no sound waves are getting through the structure over here. And so if we look at this, it's certainly not fluid because it's not anechoic or completely dark. If we look at sound waves that come reflected, there's lots of bright signal, and behind it there's a positive signal. And so it's either bones or air, and inside somebody's abdomen, it's probably going to be the bones, and this turns out to be the vertebral body, and that's what bones would look like on ultrasound. So in summary, unlike conventional radiography and CT imaging, which uses X-rays to generate images, ultrasound uses sound waves. There's no ionizing radiation, so it's a terrific modality to use for young patients and pregnant patients to look at the fetuses. Now, the difference in the speed of sound within different tissues results in roughly one of three actions. The sound waves can go through the tissue completely, in which case that tissue appears anechoic or black. It can be completely reflected at that tissue interface, in which that tissue looks hyperechoic or white. And often you'll see something in between, so you see different shades of gray. We've also covered what a cystic mass and a solid mass looks like on ultrasound. Cystic masses will have sound waves that go right through them, so they'll appear anechoic. Their borders will be very sharp, and behind that cystic mass, the soft tissues will appear relatively brighter.
Now let us move to some applications of ultrasound image. This is an abdominal ultrasound visualizing the gallbladder as cystic structure adjacent to the liver. This is the liver and this is the gallbladder. This is also in cross-section the gallbladder. Here we can visualize the whole diameter of the gallbladder. Here only the transverse diameter or cutted cross-section gallbladder. Here we have a gallbladder stone impacted within the neck of the gallbladder with posterior shadowing. That means because the stone is high density calcified, looks like the bones, no ultrasound can pass after it, so it appears like this: stone echogenic with posterior acoustic shadowing. Here the stone causing diffuse increased thickness of the gallbladder, which make it cholecystitis in a congested patient with congestive heart failure. That's why there is collection of fluid surrounding the gallbladder, which is not apparent here. Here we made the CT image for the same patient where the gallbladder stones appear radio-opaque or radio-dense. Here a diagram for the kidney, the right kidney beside the liver. This is how the normal kidney appear in ultrasound, with its cortex and medulla and sinus fat and psoas muscle adjacent to it, and the right lobe of liver adjacent to it. This is the normal kidney. Here another image of the kidney. This is the kidney normal, and this is the right lobe of liver. Here this is the kidney with proximal ureteric stone with posterior acoustic shadowing, causing obstruction and dilatation of the pelvic calyceal system and causing hydroureter. The pathology of the kidney. Another case of kidney with hydronephrosis due to distal stone. Also, we can apply color Doppler to assess the vascularity of the kidney. Here the ultrasound checking the uterus in different cyclic phases. Here the endometrium or endometrial stripe. Here the myometrium. Here the fundus of the uterus, and this is the body of the uterus. Another diagram of the female pelvic anatomy, and this is the uterus. Also, it is used to assess pregnancy. Again, here is the uterus in cross-sectional or transverse plane. Adjacent to the urinary bladder. Here the urinary bladder, and this is the uterus. Here ultrasound image in normal pregnancy. Here only gestational sac with decidual reaction within the endometrium. Here the gestational sac amniotic fluid with fetal part appearing. Here also all the fetal parts appears within the gestational sac, and it confirms intrauterine pregnancy. Here a normal scan for second trimester fetus. This is the fetus, and this is the placenta with the marker B. Regarding the indications of obstetric ultrasound, confirmation of intrauterine pregnancy, estimation of the gestational age, detection of multiple gestations in case of twin pregnancy, determination of placental location and texture, detection of anatomic and functional abnormalities of the fetus, evaluation of other pelvic masses during pregnancy. In first trimester, if the patient come with complaining of vaginal bleeding, suspected or threatened incomplete or missed abortion, distinction between intrauterine and ectopic pregnancy, all of these can be made with ultrasound. Suspected molar pregnancy, suspected pregnancy associated with intrauterine contraceptive device. In second trimester, we need to localize and evaluate the placenta, cases of polyhydramnios and oligohydramnios regarding the excess or diminished amniotic fluid, evaluation of fetal growth. Third trimester, possible cases of placenta previa, that where the placenta situated in the lower segments of the uterus, determination of fetal maturity to plan optimal time and mode of delivery, determination of fetal presentation, biophysical profile for fetal well-being, other indications like adjacent to amniocentesis, maternal abdominal disorders during pregnancy, postpartum for suspected return products of conceptions like cases where missed some parts of the placenta within the uterine cavity. We came to the end of our second lecture. Till now we have covered the definition of MRI, how it is work, advantages and disadvantages of MRI, ultrasonography, physics, and its usage and clinical indications and application, its advantages and disadvantages. Good luck. Thank you all. If you have any questions, don't hesitate.